CT's Body and Balance is sponsored by Canada Diagnostic Centres, offering private MRI and CT appointments in as little as 1 to 2 days. Visit canadadiagnostics.ca.
15% of men are living with chronic pelvic pain. I did not know that. And yet most of them will not seek care for this debilitating problem. Health Specialist Leah Sarich here this morning with what we as men can do if we have pain in a, well, very sensitive, very private area.
A very sensitive and private area, which is probably why these guys aren't coming forward, right? They're a little bit embarrassed to talk about this. But if you put those numbers in context, in Calgary, that's 75,000 guys.
That's a lot of men.
That is a lot of men. So what they need to know is that there are, in fact, treatment options. So there's things we can do for this. So I actually spoke to a gynecologist about this. So let's remember what a gynecologist is. That's a woman's doctor for all of her female reproductive organs. But she's actually the one that's helping a lot of these men. In fact, she says now that at the Calgary Pain Clinic, at the chronic pain clinic, her actual client base is now 50% men.
Really?
Yes. So they're coming to her for these problems. So I asked her, what exactly are we talking about here? She explains.
Most of them will complain of pain they feel, especially coming from the prostate or coming from the perineum. And the perineum is the area sort of between the anus and the scrotum that we would call the perineum. So they feel a lot of pain there, but they can also get pain in the scrotal area, in the testicles, in the penis, and also in the groin area. That is all considered pelvic pain.
So you can imagine, if you've got pain in that area, these men are making some dramatic changes to their lives, right?
Of course.
So, for example, this can affect just walking.
Yeah.
It can affect urination. So if you've got those two problems, a lot of these guys are not leaving the home as much as they would normally. They're isolating themselves. Or they can have erectile dysfunction, or they can have pain with ejaculation. So that could be affecting their relationships. So really, there's a lot of things that are going on here. And so what you really have to do, first off, is rule out all these other causes. So we have to make sure with the family doctor that it's not a hernia, for example, that it's not a prostate problem or a bowel problem or a bladder problem. Once that's ruled out, though, then we know, and Dr. Robert says, it's likely a musculoskeletal, so muscles and skeleton bone problem situation, right in the pelvic floor.
You can imagine if your pelvic floor is tight or is hurting, then the prostate's going to feel it, which is why in the past we've always focused on the prostate for men. And so the idea is then to work on these muscles in the pelvic floor and try and relax them and try and get them to work in a better way. Some options for that are physiotherapists, and there are pelvic physiotherapists that are trained to work on these muscles. The other thing we have is the innervation in this area as well. So for some men, it's going to be a problem with the nervous system.
Really? It could be nerve related.
It could be nerve related. She gives the example of the guy who goes for the long, long bike ride and then all of a sudden loses some feeling in that area. So it's the same kind of thing, but just in a bigger problem. So there are medications that they can use to treat some of that nerve damage. And of course, there's a pelvic floor physiotherapist that she mentioned that can work on all those muscles in there. So again, the other thing to consider too, she said, is that pain from other areas can radiate or be felt in the pelvic area. So she said, for example, lower back pain, inner thigh pain. You may not feel it exactly in those areas, but it may radiate into the pelvis. So that's where you're feling it, but that may not be where the pain's actually coming from.
That's not the problem area.
Exactly.
Interesting. Okay, what if you need treatment or help? What do you do?
So the first thing you want to do as a guy is you want to have a conversation with your GP, your family physician. So you start there. Say, this is what's going on. So she's going to rule out some of those things we discussed, the hernias, things like that, bladder and bowel problems. She's going to rule those out. And then, once those are ruled out, she's going to refer you to a urologist to make sure that the prostate's functioning properly. And if it's not the prostate, then you're going to get that referral to Dr. Robert, and she'll see you at the Chronic Pain Center here in Calgary, and she'll get a look at what's going on and get you some treatment options.
So you got to cross those things off the list, and then you can try and pinpoint what it is.
Exactly.
Cool. And you're going to put all this on your blog,
It'll
right?
all be on the blog, you bet.
All right, good stuff. Leah Sarich, our health specialist. Who knew? Male pelvic pain.
There you go.